you hear before beta thalassemia major? Do you know that beta thalassemia major carriers have been increasing rapidly, about 80 to 90 million of people in the global? Okay, let's talk about beta thalassemia major. Beta thalassemia major is a hereditary gene disorder which oxygen is not supplied to body due to mutations in beta globin gene in hemoglobin. According to statistics, carrier rates of beta thalassemia major is about 4.5% among Malays and Chinese in Malaysia, while the mean cases from 2013 to 2017 is 2,501.2 every year. After I found this, it was such a wow for me. And in 2018, 2,676 cases are reported. Can be seen that beta thalassemia major disease is become more and more. But how come Malaysia can have so much of cases? Why? Let's see what's the factors causing this increase of beta thalassemia major cases. According to this beta thalassemia major journal, inheritance of one normal gene and one abnormal gene from each parent will give birth a fetus as carrier of beta thalassemia major. In another situation, if both parents have abnormal carrier gene, their children will have 25% of getting beta thalassemia major, 50% as carrier, and 25% of receiving normal genes. How about the second factor? Mutations in hemoglobin subunit beta gene is another factor of beta thalassemia major. This will reduce hemoglobin and red blood cells, then leads to anemia. The third factor of beta thalassemia major will be transcription of mRNA. This results in absence of beta globin polypeptide change in beta thalassemia phenotype. Now, I would like to interview a beta thalassemia major patients. Let's go! Hi Dora, nice to meet you. I'm reporter from TV10. May I know what are the symptoms when you're suffering from beta thalassemia major?
Oh, hi! Actually, symptoms of beta thalassemia major are not shown at birth, but appear when I was 1 or 2 years old. During my childhood, I would feel tired frequently and look so thin. I still remember that I was the smallest sized child among the children in neighborhood, but actually, I'm the eldest. Haha!
Oh, I see. Then you must be low cute. Other than this, is there any other symptom of beta thalassemia major that you had experienced before in early life?
Oh yeah, at that time, this disease also causes me to have jaundice, abdominal distension, and bone deformation. And because of this, my skin, whites of the eyes, and mucous membranes all turn yellow. It was so incredible, you know.
Oh my god, I think I can imagine that. But think positively, it actually looks like a cute yellow minion, right? Alright, thanks so much for today. Beta thalassemia can be diagnosed through measurement of red blood cells and hemoglobin by high-performance liquid chromatography, automated hemoglobin electrophoresis, and followed by DNA tests incorporating with PCR, which is polymerase chain reaction. Besides, amplification refractory mutation system, reverse Doppler hybridization, and microarray DNA analysis will also be used to diagnose this disease. Prenatal diagnosis like chorionic villus sampling and amniocentesis are used as well. Now, I would like to ask a doctor, what's the treatment for beta thalassemia major patients that doctors usually carry out in hospital? Hello, Veronica Park?
Yeah, I'm Dr. Veronica. Anything that I can help you?
Oh, it's like this. I just saw you in newspaper, and here mention how you very professional in treating beta thalassemia major in hospital leh. Can I know what's the treatment for this disease?
Oh, thank you so much. It's my pleasure. The primary treatment for beta thalassemia major is blood transfusion. This treatment is needed because of the occurrence of anemia in beta thalassemia major patient which has low blood volume. But the side effect is that it will cause iron overload. Therefore, iron chelation therapy is needed to remove excess iron from the body through urine or stool using chelators like deferoxamine, deferasirox, and deferipron.
Wow, they're interesting. But doctor, is there any permanent cure for beta thalassemia major?
Yeah, of course. Currently, cord blood transplantation and stem cells transplantation, also known as bone marrow transplantation, is available for patients. However, bone marrow transplantation has limitation of lacking human leukocyte antigen identical sibling donor. So other than medical treatment, a beta thalassemia major patient is recommended to carry out physical exercises to increase their intestinal iron absorption from the gut and thus reduce serum ferritin levels. They can try to increase their exercise time gradually based on their tolerance. So yeah, that's it. So may I know that is there anybody around you have this disease for you to make this call?
Oh, no lah. Actually, I just want to know how pro you are until can be reported on newspaper. Okay lah, bye. Beta thalassemia individuals should take daily nutrition into consideration, as we know that increased iron absorption from the intestinal tract is a major characteristic of this disease. Therefore, nutrition that can reduce the iron absorption is essential. Foods that rich in iron such as liver, kidney, and multivitamin fortified with iron should be avoided. And food that rich in heme iron are encouraged to limit the consumption. For example, beef, seafood, canned sardine, tuna, and so on. Moreover, using vegetable proteins and white meats is recommended. And what about non-heme iron food? There are cereals, roots, and tubers like potatoes and carrots, vegetables, fruits, and nuts. The iron absorption rates of these foods is much lower than heme iron food. A diet containing adequate calcium like milk, cheese, dairy products, and kale is always recommended. Why? It's because they can reduce the absorption of iron as well. Iron overload can lead to cellular stress, so that's why here we need vitamin E, which has the function of reducing cell damage. We can find it in so much of foods, veggie like asparagus, collard greens, spinach. Oh, spinach is my favorite. Veggie oil like sunflower oil, wheat germ oil, peanut, hazelnut, walnut, almond. Do you know that oxidative stress of iron overload is the main cause of vitamin C deficiency in beta thalassemia major patients? Actually, vitamin C will decrease ferric and ferrous ions in tissue and cause cellular death in beta thalassemia major patients. It is also antioxidant in human plasma against lipid peroxidation, which induced by peroxy radical. But this antioxidant protection is not enough for beta thalassemia major patients. So, they are suggested to receive vitamin C about 30 minutes to 1 hour after the start of deferoxamine infusion. see that vitamin C also facilitates iron access to chelators and improve the efficacy of iron chelation therapy. By this way, cardiac magnetic resonance imaging and hemoglobin level will rise while serum iron, ferritin, and liver iron concentration will be lower. Vitamin C can stimulate iron toxicity too and increase non-heme iron absorption in gastrointestinal if there are no chelating agents. And now, it comes to conclusion. To reduce the cases of beta thalassemia occur in Malaysia, free population screening is essential to identify beta globin gene mutation in healthy individuals as well. Public education about beta thalassemia is needed to raise communities' awareness, while mutation characterization is required in consanguineous marriages to develop effective genetic counseling. So, if you are watching this video, still wait for what? Go to the hospital and check for the gene of beta thalassemia now. Go, go, go! Oh wait,